All right, well, welcome everyone. Sorry we're getting started a little bit later than normal, but we're waiting for some people to come on. This is our Zoom at noon. Welcome to the Rotary, Jacksonville Rotary Club. Uh, we have a couple of announcements while we're waiting for people to get on. Um, I have spoken with many of you over the last few weeks and months, and many of you are asking when we're all going to be together in person. We're definitely working on that. And our own Marie Nagy has been, she's actually designed a survey. I see Marie's on the call with us. Hello. Marie has done a great job, and she has created a short survey. So today, after our meeting, the survey is going to go out. And what it asks is basically, when do you guys want to meet in person? Specifically, we need to design our upcoming budgets, and we need to make some other decisions, like telling the Omni when we're all getting together face to face or virtually or both. So that's something we really need to work through. So that survey will go out after this meeting, and it will be available until Friday. After Friday, it will close out. But again, I remember I've talked to so many of you who are so interested in doing one or the other. Many of you, because of health concerns, are not going to be able to meet in person for a little while, and we completely understand that. But we need to construct those budgets, and that's going to certainly dictate what that looks like. We are, let's see, Sherry, do we have John with us yet? Chevalier.
Not yet.
Okay. There we get a number of people coming on.
Not sure why the delay.
There we go.
John should be connecting any moment.
All right. I want to welcome all those who are joining us. We just doubled our size of members on the call. So just one more time, we'll have a survey going out at the end of this meeting. Marie Nagy and her team have designed a very short survey. And what we're trying to determine is when we're all going to get back together in person. I've been talking about that for the last several weeks. It's a very important issue because our budgets depend on our answer. The Omni has reached out to us and they want to know as well. So please look for that survey in your inbox and fill it out this week. We will close out voting on that by Friday at 5 p.m. So again, don't forget to fill the survey out at the end of this meeting. And we're going to get going. If we have John on the call. John, do we have you? Hey, Seth. See you. There's John Chapelier. There we are.
All right, now we're good.
Hey. All right.
Hey. Hi, everybody.
Thank you, John.
Let's see, you'll be looking for an invocation.
Well, we have a lot to give thanks for, so if you don't mind leading us off.
That's very true. All right, let's give ourselves some quiet time to reflect on these ideas. Let's imagine life as a game in which we are juggling 5 balls. They are work, family, health, friends, and spirit. Our job is to keep them all in the air. Soon we understand that work is a rubber ball. If we drop it, it will bounce back. But the other 4 balls, family, health, friends, and spirit, are made of glass. If we drop one of these, they will be irrevocably scuffed, marked, nicked, damaged, or even shattered. They will be changed forever. Because of this, we must strive for better balance in our lives. How do we do that? Set a path of clear intention for ourselves each morning and check in frequently on our progress and our successes. For our own health, forgive others, and live each day using love as our default emotion. Become grateful for all things at all times. A balanced life is the path. It is worth working for because it is the path to peace. Amen.
Thank you, John. Amen. Well, what we're going to do is we're going to reorganize a few things. And we're going to award some blue badges for the first time using Zoom. And we're going to move that to the end. Jim's working to join us on the call now. Before we do that, though, Michael Mayo currently serves as hospital president of Baptist Medical Center, where he is responsible for the operational and strategic direction of the flagship hospital of the Baptist Health Network. U.S. News and World Report named Baptist Jacksonville among the nation's best hospitals almost every year over the past decade, and the organization was cited as the #2 best hospital in Jacksonville. It's been listed as the #9 best hospital in Florida. Previously, Michael served as the president of Methodist Dallas Medical Center, a level 1 trauma center, and the flagship location of the Methodist Health System in Dallas, Texas. Michael earned his Master's of Science in Healthcare Administration from Texas Women's University and his Bachelor of Science in Human Resource Management from the University of Alabama. Presently, he is enrolled in a doctoral program at the Medical University of South Carolina. He's a board-certified healthcare manager and a fellow with the American College of Healthcare Executives. Michael served as ACHE Regent for the Northern and Western chapter in Florida from 2017 to 2019. He was elected as the ACHE governor on March 2019. Michael is a very busy executive, but he still makes time to serve as an adjunct professor at the University of North Florida, Brooks College of Health. Michael is married to Jennifer Brooks Mayo and has 2 daughters and 4 grandchildren. We're pleased to have our own Michael Mayo introduce today's speaker. Michael?
Thanks, President Tom, for that introduction, and appreciate the opportunity to address my fellow Rotarians and introduce Dr. Bill Putnam, who is not only a colleague, but a close friend. Dr. Putnam serves as the medical director of Baptist MD Anderson and is responsible for directing, planning, and coordinating all the clinical activities for Baptist MD Anderson and its physician cadre. Before he came to Baptist, he was the medical director and professor of surgery and chairman of the Department of Thoracic Surgery at Vanderbilt University Medical Center in Nashville. Also the Ingram Professor of Cancer Research and program director for the residency program in thoracic surgery. Prior to coming to Vanderbilt, Dr. Putnam was with the faculty of MD Anderson Cancer Center in Houston. He served as deputy chairman of the department from 1995 to 2004. Dr. Putnam also has served our country in the United States Navy. He was activated during Operation Desert Storm as a naval reservist and served as the department head of the Department of Cardiothoracic Surgery, Naval Hospital, San Diego. He retired in 2011 as a captain, Medical Service Corps, United States Naval Reserve after 21 years of proud service. Certified by the American Board of Thoracic Surgery and the American Board of Surgery, Dr. Putnam received both his undergraduate degree in chemistry with honors and his medical degree from the University of North Carolina at Chapel Hill. He completed his surgical internship and junior assistant resident in surgery at Johns Hopkins Hospital in Baltimore, his general surgery residency at the University of Rochester School of Medicine and Dentistry in Rochester, New York, and residency in cardiothoracic surgery at the University of Michigan in Ann Arbor. Those are all the important clinical facts about Dr. Putnam, but what I want you to know that he is an outstanding individual who cares so much about our patients and leads with such strong conviction about providing cancer care to the people of our community. And we are so fortunate to have him lead our program. And I'm even more fortunate to declare him as not only a colleague, but as a friend. Please help me welcoming Dr. Putnam.
Thank you, Michael. Can you folks hear me okay?
Yes.
Excellent. Thank you for that. And I'm going to share my screen. Let's see how this works out here. Share. And here we go. How about this? All good?
Yes.
Okay. First off, it's a pleasure to be here today with all of you. Thank you for the kind invitation. And let me talk for a few minutes here about a program that is very important to me and to this community, the Baptist MD Anderson Cancer Center. We opened our doors in September of 2018 in our new building. And the new building was created to really meet three goals: to replicate the MD Anderson Cancer Center Houston model of care within the Baptist health system. MD Anderson Houston is the #1 cancer center in the United States, as recognized by U.S. News and World Report. Secondly, to integrate as a partner the clinical care with MD Anderson guidelines, protocols, pathways, and clinical trials, and to provide even better cancer patient care, minimizing the morbidity and mortality of treatment, to achieving better survival, and to enhance patient and physician satisfaction. Now, this building was opened in September of 2018, a very iconic building for our community, and certainly represents the forward-thinking vision of our Baptist leadership in providing cancer care and really providing a tangible, visible commitment of their commitment to this community. We had leadership transitions in July of 2019. Brett McClung became our president and CEO, capably assisted by Elizabeth Ransom as our chief physician executive. And since then, we've had some tumultuous times. As you know, Hurricane Dorian barely misses the Florida Peninsula in late August. We've had, after that, we've had our COVID-19 emergency orders put into place. The governor's orders took away all elective procedures, and in so doing, really created a significant financial impact on healthcare delivery in the state, and as well throughout the nation. This pandemic has had a global impact. Almost 8,000 cases, close to almost 500,000 deaths, and the United States is leading the way with over 2 million cases, 115,000 deaths, and is affecting the gross domestic product by dropping it by over 2.3% on an annualized basis. Hospitals have been affected to a great extent, and as the COVID pandemic ebbs, we are bracing for a spike in cancer patients because the delayed care in screening and in care is going to allow patients, will require additional care, additional resources in the near future. This has had a financial impact on hospitals throughout the United States. It's estimated that almost $2 billion of losses will be sustained by hospitals. Our fiscal year 20 budget has, as you can see here, for Baptist, has been impacted to a significant extent during the COVID pandemic, although we are now achieving budget levels as would be expected. The impact on Baptist MD Anderson has also had a significant, has had less of a significant impact, although elective surgery has been canceled for the pandemic. That has recently been reopened. Screening for cancer services, mammography, lung cancer screening, colorectal screenings with colonoscopies and all have all been canceled during this elective procedure moratorium. However, our chemotherapy infusion center continued. Our radiation treatments were shortened as we possibly could, as appropriate, and we did continue urgent surgery for life or limb because we can cure patients with cancer. In addition, our community, our nation, our community has been awakened once again to the needs to overcome racism, racial bias, and social injustice, which has been highlighted by the recent tragic deaths of a number of individuals: George Floyd, Breonna Taylor, Ahmaud Arbery, and others. And that has affected our hospital, our system, and our community. And as we think about moving from this understanding and acknowledgement of these implicit biases to action to overcome these conditions, we will have within our Baptist health system, within Baptist MD Anderson, listening sessions, a goal to manage and remove implicit bias, and to have these hard conversations with each other, with our team members, and in so doing, really create a model for deliberate action to where these conditions can be identified, they can be recognized, we can talk about them and move our health system and move our community and move our nation forward. So this is our cancer center, 9 stories, 330,000 square feet, and we are providing care to a large patient population. This reflects the patients from across the United States that have come to Baptist MD Anderson, and we have had, mostly in the eastern half of the country, although some patients from out west have also come. And you can see this southeastern quadrant has been more. We've had more patients come from the southeastern quadrant of the United States than anywhere else. But most of our patients obviously have come from the Jacksonville community, and we've had a great and warm welcome from our community and from our colleagues, our physician colleagues in this community. Our ranking has been, so cancer centers are ranked by the numbers of patients that are seen. So you can see that Baptist MD Anderson, when we were ranked in January of 2020, was ranked number 5 in the state, which I think is a remarkable achievement and recognizes the commitment that we have had as a system to achieving even better cancer care for our community. We expect that this will continue to grow over time, and we will likely be number 4 or 3 in the foreseeable future. To do that, we do require a professional workforce. Now, that professional workforce is by physicians. Those physicians are salaried. They are neither rewarded, they're neither advantaged nor disadvantaged by the decisions that they make, with the goal for the decisions to be in the best interest of the patient. And with any salaried workforce, we want to ensure professional behaviors. So professional behaviors are really the foundation for patient and coworker safety and quality outcomes. They improve communication, decrease burnout, they reduce medical errors and legal risk, and will have an increase in professional job satisfaction. The Vanderbilt University Medical Center has created this Center for Patient and Professional Advocacy. It is a national presence with over 80,000 physicians that are included. We have over 2.6 million patient and coworker observations, and they provide the ability to coalesce almost 200 clients in almost 30 states. Patients and coworkers who have concerns can be reviewed, they can be tracked and codified, and we can implement measures to identify those challenges with our patients and with our healthcare providers. So this Center for Patient Professional Advocacy, we will have an initial assessment by our Vanderbilt team within the next several months. It was delayed a bit because of the COVID virus, but we will move forward with this in the near future. We've been able to recruit high-level, high-quality faculty. We have individuals who are at the professor level at medical schools and universities across the United States. And we have been able to, in recruiting these individuals, bring that level of experience and that credibility to Jacksonville, to Baptist Health, and to Baptist MD Anderson Cancer Center. I serve as the chair of the American Board of Thoracic Surgery, responsible for the education of our future cardiothoracic surgeons. Dr. Petsy serves on the executive committee of the Society of Surgical Oncology. We have other surgeons serving on the Commission on Cancer. Ed Gorek serves on the Myelodysplastic Syndrome Steering Committee. Jennifer Crozier is going to be the regional chair for the American Society of Clinical Oncology review sessions. So we have the ability of these individuals, whenever they take the podium, to emphasize their presence in Jacksonville, Florida, their affiliation with Baptist MD Anderson Cancer Center and Baptist Health. We've recruited faculty in a significant way. 13 faculty within cancer medicine, medical oncologists, 6 radiation oncologists. We have 17 specialist surgeons involving 8 to 10 separate surgical subspecialties to really meet the needs of our patients and this community. And this is from almost nothing 5 years ago. So we've recruited almost 40 faculty in that time frame. We'll recruit future faculty as well, again, to meet the needs of our community and to meet the needs of our patients. We provide clinical trials from MD Anderson, Houston, Texas, as well as with other universities such as Duke and others, in order to meet these needs. So we have over 40 trials that are open, which have expanded almost threefold since 2017. So we've begun to develop this momentum to provide more novel, cutting-edge care for patients with cancer. So 40 treatment trials carries a big impact. And we enrolled almost 500 patients in 2019. We will be close to that number in 2020. The COVID virus did decrease our patient accrual a bit during this time. We have a number of quality initiatives so that we can hold ourselves accountable to national benchmarks. The Quality Oncology Practice Initiative, or COPI, is an international quality assessment and improvement program for outpatient hematology oncology practices, and we will do that. There are only 9 sites certified in Florida. We would be the first site in Jacksonville. They've approved our policies, standard operating procedures. We will have a survey in September, and I expect before the year is out, we will achieve that COPI certification for cancer medicine. The National Quality Forum has national measures to which we will hold ourselves accountable and use these for a continuous quality improvement to minimize the impact of medical care at the end of life. In other words, we don't want patients to be getting chemotherapy up until the day they die. We don't want patients to die of cancer in the ICU. And we want to make sure that patients receive the care they need at the end of life in hospice whenever possible. And to be respectful of patients and their wishes as to how they wish as how they wish to be treated. The Division of Surgery has a number of quality measures. Surgeons have always carried high visibility, high impact care to patients. We have the National Surgery Quality Improvement Program, which, as Mr. Mayo knows, is helping us to decrease the incidence of blood clots in the legs. We are promoting enhanced recovery after surgery to practically eliminate the need for narcotics in patients receiving care. We have our National General Thoracic Surgery database to further reduce the length of stay and to improve the quality of care that our patients with lung cancer surgery and esophageal cancer surgery are receiving. So we're making a big difference in that patient population. Finally, let me close with the impact that our system has had to Jacksonville and our region. We are a partnership. Baptist Health and MD Anderson formed a partnership to create the Baptist MD Anderson Cancer Center and to provide the cancer care that this community so appropriately requires. And to provide that care, we have recruited experienced, validated, full-time cancer experts, many professors of their discipline within university-affiliated and medical school-affiliated programs. We understand that we have had an impact from the COVID virus, but we also understand that the impact that we have on the cancer program is not as much. Still, healthcare is expensive, and the financial impact that we all identify, whether we are business owners or whether we are patients or employees, we understand that there is an impact on healthcare, and we can mitigate that impact by achieving the best care without overuse or underuse of services through a multidisciplinary care model and salaried physicians. We can meet the needs of our community and meet the needs of our patients in a very respectful manner. And in so doing, we can provide even greater recognition of Jacksonville as a center for quality healthcare. It's my privilege to serve as the medical director for Baptist MD Anderson. My wife and I have been warmly welcomed in this community. I am so grateful for the opportunity to have this position and to work with colleagues such as Michael Mayo, Brett McClung, Liz Ransom. And I appreciate so much the invitation to speak today from Julie Mason, and thank you all for your attention. I'm happy to answer any questions.
Thank you, Dr. Putnam. There we are. Dr. Putnam, thank you from all of us. You are a crown jewel in a really amazing group of hospitals that we're blessed enough to have in our region. And as I travel, to be able to tell people we have an MD Anderson and we have Mayo and we have so many great hospitals in this area, it truly is something that is a bragging point for Jacksonville, Florida. So thank you for all you do, not only for the residents of our city, but to make our city one of the shining stars in Florida. So we really appreciate that.
There's been some questions that have come up. Should I just read the questions and answer them? Would that be okay?
Sherry, and you're welcome to do that, Dr. Putnam, if you want to do so. Pick the ones you want, but
Sounds good.
Yeah, please go ahead.
So one question was, where are the majority of cancer patients coming from, and are there limitations on who's being accepted? Well, the majority of patients are coming from the southeastern United States, and the majority of them are from the Jacksonville area. And we see patients with known or suspected cancer, patients who have had consequences of cancer or cancer care, or and sometimes even patients without cancer that have extraordinarily complex problems. So we try to create a model by which patients who need care can receive it, and in so doing, elevate the level of care for this community. we are grateful for our community colleagues, because our community colleagues have provided for us continuity of care. Our primary care doctors, our medical colleagues, our surgical colleagues, and we are able to meet those needs we're able to meet those needs, I think, collaboratively within our community. Second question was the general status of cancer research worldwide. That's a big question. I'm not so sure I'll be able to answer it completely in a sound bite. But I will say that the standard treatments remain effective. So chemotherapy, surgery, and radiation therapy in various combinations have proven the test of time and do provide still excellent care for patients. In addition, we are learning through our research trials that we can enhance the body's immune system. We can provide a boost to their immune system to really fight cancer more naturally than with chemotherapy, which really serves to decrease the metabolism and kill the metabolism of cancer cells, and does have side effects that make people quite tired. We're embarking upon a precision health initiative within Baptist Health so we can understand better the genetic modifications of the cancer cell to target those treatments, and also to identify the characteristics of the cancer, the person, these germline mutations, which may pose increased risk for cancers in themselves or family members. The women are familiar with the BRCA gene and the predisposition to cancer in individuals with that characteristic. So we're learning how to decrease the need for surgery. We've got a clinical trial open right now so that women who respond exceptionally well to chemotherapy and radiation from breast cancer may never need to have surgery for their breast cancer. A fundamental shift in cancer treatment. These hyper responders, as they were, may not need cancer.
Dr. Putnam, we have time for one more question. About 2 minutes.
Okay. As I said, is the Northeast Florida employee pool deep enough, or is it necessary to recruit from outside the state? Well, it's like the NFL. You want to recruit the very best people you can to meet the specialty need, to meet the standard and specialty team needs. So we are looking for the highest caliber faculty that we can, and we want to be very deliberate in evaluating a diverse population sensitive to gender, race, ethnicity, to really mirror the population that we have in order to provide even better care.
Wonderful. Thank you again so much for being with us today and for all you do.
Thank you.
We have a couple of things we need to wrap up just because we had some difficulty getting everyone on in the beginning. As everyone knows, we've had a terrific year in membership, and I want to thank everyone who has sponsored new members. President-elect designee Jim Agee has done a wonderful job communicating with members, keeping them engaged, and updating our onboarding of new members by redesigning our new member orientations. We're doing all kinds of new things with Zoom, and today we have blue badges to present to the members who have completed our process. I'll now turn it over to Jim for a minute or two. Jim, are you with us?
I am. President Tom Bryan, I'm going to start by going on record here and stating what everybody who's been working with you already knows, that you're just such an effective and inspirational leader, and the Rotary Club of Jacksonville has benefited so greatly during this time of turmoil by having you as our president. On behalf of the membership committee specifically, and the Rotary Club in Jacksonville in general, thank you for what you've done to energize our club. We've grown over 11% in our membership. And for a large club like Jacksonville, that is just outstanding. Through your guidance and motivation, we all know how competitive you are. There's no doubt about your commitment to making Florida's first club also Florida's largest club. Congratulations on your success. I'm now pleased to recognize the following members who've earned their blue badge by spending at least 6 months getting to know everyone. And that's been quite a bit of a challenge during this COVID-19 pandemic by completing new member orientation, attending our socials. And I want to thank Membership Orientation Committee Chairwoman Shelby Dorsey and her entire team for the time and effort that they put into improving the entire orientation experience. Kevin Hyde and Alex Safakis were neck and neck for the honor of Lanterne Rouge, the longest serving red badge members. But by one day, Kevin Hyde got the victory, and as a result is our first blue badge recipient. Kevin is an attorney with Foley and Lardner. His classification is human resources. He's on the program committee, and as most of you probably saw, he explained the payroll protection plan to us during one of our Zoom at Noons. His sponsor, Marie Nagy. Alex Safakis, who's the president of JWB Real Estate Capital. His classification is real estate, residential asset management. He's on the membership committee with me, and he's helped me greatly in development and vetting. And his sponsor is Tracy Jinks. Seth Rothstein is an attorney, Adams, Rothstein, and Siegel. His classification, law, insurance. He's on the Sergeant of Arms Committee, and he always greets me with a smile and a hug and compliments me on my singing of the Air Force song. So he's a very warm spot in my heart there. His sponsor, Brian Cooksey III. Marcus de Carvalho is the president and CEO of the Center for Healthy Mind and Well-Being. His classification, medicine, counseling services. He's on the front line of this Wuhan coronavirus pandemic, and his sponsor is Doc Shaw. Susan Masucci, president and CEO of Ruckus Advertising. Her classification, business services, digital marketing. She's on public image and programming committees, and expecting great things from her going forward too, to keep promoting the brand of Rotary and advertising all the good that our club does in the community. Her sponsor was Kathy McElvain. Pete Denholm, he's the managing director and owner of Supporting Strategies, Northeast Florida. Financial services and bookkeeping is his classification, and he was super active on the signature event. Kelly Shaw, I really appreciated his help and wanted a call out there. He's also helped me greatly on the budget committee. His sponsor, Bill Sorensen. Ron Davis, attorney for with himself, Ronald J. Davis, PA. Law is his classification, family law specifically. He's chairman of First Coast Friends of the National Rifle Association, and he's active with the Northeast Florida Boy Scouts. His sponsor, Kelly Shaw. Sean Nelson, executive director, managing partner, Dolphin Point Healthcare. Classification, nursing home management. You don't see a picture there, but he is not missing in action. He, again, is another one of those people on the front line of this pandemic. When I was chatting on him with the phone during one of the call and care things, he was actually rescuing somebody trapped in an elevator. So this guy is multi-talented. Sponsor, Artist Gilmore. Bob Arablo, president, Jacksonville Iceman Hockey. Sports hockey is his classification. On the programs and the membership development committees, I'm looking forward to working with Bob to get some more sports-oriented people into our club, and his sponsor is Howie Wanamaker. Kevin Carlton, Vice President, Business Relationships, JP Morgan Chase. His classification is banking. He's going to be our Rotaract liaison going forward. He's got his experience as a past president of Interact, grew up in this area, knows the young folks well, and looking for good things from him. As sponsor, Sid Jones. Virginia Hall, president, St. Vincent's Healthcare Foundation, hospitals, foundations, her classification, on the project and screening committee, fittingly, and I'm expecting her to assist and guide me with the Rotary Club of Jacksonville Foundation, our local charity, to get it that more engaged. Her sponsor, Randy DeFore. Tammy Hodo, Inclusion and Diversity Consulting, all things diverse. Her classification, consulting, diversity training. Could there be anyone in our club that is more needed right now? Your timing is perfect, and we are so happy to have you as part of our team to lead us forward. Signature event, again, a big help to Kelly Shaw, and so pleasant when I meet her at the Sergeant at Arms Committee. Her sponsor, Maria Hain. Maria Hain also sponsored Pete Hicks, who's the Director of Strategic Partnerships, Youth Crisis Center. Associations, Youth Crisis Center is his classification, was two programs, the last program. We got to hear from his boss. He's chairman of our hands-on committee. Been very busy, going to be more so with installing smoke detectors and with Youth Crisis Center telehealth gear. His sponsor is, as I said, Maria Hain. Scott Monroe, attorney with Monroe and King, classification of law, crime, DUI. Colin Care, talking with him again, another person that I had the pleasure of chatting with. He's a big advocate for ovarian cancer awareness, and that truly fits our strategic goal. We just heard a speaker talking about it. As everyone knows, our strategic goal of this club is health and education, and he's right in there with that. Finally, we've got Hal Gatewood. He's the Senior Vice President of Merrill Lynch. Investments, family planning is his classification on the Project and Screening Committee, also helping me with membership development. And I just want to throw out here, it's honest criticism and critiques like Hal gave me after going through orientation that shaped the reroute and some of the changes and the way we've done the orientation going forward. And it's that kind of active engagement and getting involved in the club that makes all of us so much better. And I want to thank Hal for doing that. His sponsor is Ed McCarthy. Lastly, I just want to thank everybody. President Tom Bryan, clearly you led the way on membership, but the club had to follow. Thank you to all of our new member sponsors. This list of sponsors shows me who's living up to the ideal of Rotary, because you have to inspire someone to want to contribute and participate at the level that's expected in our club. And that tells me that the new members see something in these sponsors that they want to emulate. Sponsors, thank you for being the inspiration, but your work is not done. I'm not letting you off the hook. Being an engaged mentor is just as important. And we've got to get our new members joining committees that match their passions and talents and make their Rotary experience rewarding. Congratulations to our Blue Badge recipients. Thank you very much.
Thank you, Jim. And welcome all our Blue Badges. We're so honored to have you in our group, and we're just looking forward to you being more active each day. Also want to thank each of you. Our membership is the best anywhere. And it just reminds me each time I get off the phone with one of you how honored I am to serve in this role. Please don't forget to fill out the survey. It's very important, and we'll close out by next Friday. Michael, Bill, I want to thank you for being with us today. Wonderful program. Finally, it's hard to believe a year has flown by, but please join us next Monday as I pass the gavel to President-elect Jerry Kelly. We have a great lineup of guests, and I think it's a program you're not going to want to miss. So thank each of you for a wonderful year. I look forward to joining you for a meal out on the main ballroom floor as soon as we're back together. And I'm just honored to have been able to serve as your lead volunteer this year. So with that, everyone have a great week. This meeting is adjourned.